when we have the jobs to do, it is better we take up the responsibilities. Right? Now, I hope all of you are having the, what is that?
Yes.
Don't mind anything, but at least have a copy. Because when I tell you to go and see to the page number, it will be better. It will be easy for you to understand what the diagram is. As sir said, seeing is better. And true is after learning, I remember.
Coordinator was R.S.Gopika, so I used to do this and send to the filler, and then we used to come back to the core committee. So this is how it was going on. And now the end result you are seeing. Now again, it is open. If some mistakes, some errors are there, I know. I have made a note of it, but I throughout India, I think by October the CBDC second year classes will begin. And we are doing this because of what? Because of this lesson which has come in March 13th, 2003. So because of that only we are going to implement. Otherwise, we will not have the authority to implement, we will have the authority to implement the RS5. So RS5 will continue to be used as well as RS3 also, because if any students are there in those batches, we have to conduct exams for them and declare the results. You cannot apply this syllabus for those students. So that clarity I hope everybody has it. Now, the subject code will be Home, UG, Path, M. So this is the subject code for our subject. Now, the learning objective, the same thing which sir has put up, that is what I am telling you. Now, how to, conduct this session has been, guided by Dr. Munir sir. So he has given the template, and the inside what is there, it is our work. So he has guided in every aspect here, because the resource person, people who are doing this for all the subjects across the country should have. So this is then only it becomes a standardized guide. However, understanding, I cannot do some presentation in pathology, FMD, no, I will do something, no, it is not like that. So the standardization is beginning from our side first. So first we should have that standard. Okay, so these are the objectives. Now let us recall the review of CBDC for this subject. So it goes on, as I told you, there are around 12, and in this, I will not comment on the lesson plan, there is a timetable, and then academic calendar of events, which will depend on in your college timings and your university calendar of events. Okay, so there that flexibility will be given to you, and even the lesson plan also, the flexibility has been given. You want, you do it, because as a person you want to evolve. You can follow that. Otherwise, no, you feel you are alone in the department, it's very difficult, no issues. You need not, maintain the lesson plan. So that is what Dr. Jain has said. It will not be made compulsory. The QCI inspectors will not be asking about the lesson plan. So that is what sir has told us. So if you want, more confidence or clarification, you can ask your individual, principals to again talk personally to Dr. Jain or put an email, which is better you will have it in writing. It will be on the safer side. We will be busy in implementing the curriculum, and what they are telling, QCI next will be surprise. That is what they are telling. We will not even have time to put that. So better to be on the safer side, to take it in writing. But sir, see, at least I have the confidence when sir is telling, President of NCH is telling that I will inform the QCI instructors in future not to specify or ask in detail, like writing the lesson plan or a code or whatever. I think we can do it. Now demonstrate the flow of syllabus. Explain the different heading of the syllabus organization. Now this is the morning of the sir has said, but with respect to our subject, we will try to go. Illustrate the salient features of the syllabus. Clarify the concerns of participants about the innovation to the syllabus. It's not the all in a Okay. Now what is the flow of the syllabus? In the morning, as sir said, now this will belong to which category? Sir used two words. One is a transmission mode, another one is a transformation mode. So this belongs to transformation. Right? Very good. So it started off with the national goals. All the RS3 also participating any syllabus, but there, it was just for half a page. Just remember, if you recall, the national goals was for half a page, and next when we come to the program outcomes, we have around 5 or 10 lines with it there, very minimum. And syllabus too will be over within 2 to 3 years. That's it. But even then, we have taught the students. Complete syllabus we used to. All of us agree? We have taught the students. There was no guidance for us. Nice to know also, we have asked the students in the Bible also, we have asked in the theory. But now, we have our guidance. Okay? So, it starts with the national goals, program outcomes, goals, outcomes, domains, competencies, content, prioritization, ending up with the blueprinting as this is very important. The conducting of the exams and the variation and the declaring of the results. Now, this will decide what we have done for the entire 8 months or 10 months, depending on how how many months you will have been lecturing. Blueprinting, outcome and assessment, activities, instructional assessment. Now quickly we go through the national goals. I will not go into the details. If you go to the draft of the syllabus, it will be the beginning. When if you have taken the whole draft, no problem. But you can just go to the soft copy and go through the national goals. This is all there. Okay, I will not go into the details. Okay. So this is about the national goals. Based on this, the program outcomes, that is for second BHMS, what will be the program outcome? So the program outcome for second BHMS, it is for the second BHMS. Please note the point. It is not for the other subject. It is for the entire BHMS, second BHMS. Okay. So these are the program outcomes here. So based on this, now we come to the course outcome. Now this is very important. Now we are coming to answer. So the first one, pathology and microbiology. It makes the student to recognize the importance of study of pathology and microbiology in the homeopathic system of medicine. Now, doctor, what's your name? Sorry, no problem. Somewhere, as Sir said in the morning, all homeopaths are undergoing what is known as I will relate the morning lecture with my this one. So, we are bringing out doctors for what? To help the people and to see that the health is missing, the quality of health is missing. And our graduates, when they travel and when there is an emergency or when they see an accident, they do not know what to do. And if they do the video recording like a lay person and put it on the YouTube, what can we do? Identity crisis. So that will solve the problem. Okay? So when we start giving them, see, integration has started even in the first year also. They will get the confidence, which we didn't have. When around 1986 batch student, forget no what integration, no classroom, no teachers only, because I was first batch student, so it was a budding institution. So along with the budding problems also were there. But anyway, our generation was entirely different. We have been efforts, and that is why we are where we are. Okay? So that is more important now. So please make it a point to do the integration. Then, understand classification of diseases as per master. Now this we would know whether LCH is telling us or not, or whether CBDC is telling us or not. I will do it regularly, and I think most of the pathology teachers will also do it. Why? Because there is nothing to tell in the allopathy classification of diseases. But there is so much to talk about in classification of diseases as per our master degree. So there I think we can relate because they can relate it with the case taking, and they are taking the case. Now, understanding the common and important diseases based on their evolution, etiopathogenesis, pathology, process, and prognosis. So it is nothing but we are going to focus on general pathology and then systemic pathology, and then the bacteria, the viruses, the parasites. So it is understood. Then skill and competence. Here, I developed skill in the identification of pathological features. We are doing it. It's not that this is something new. We take a specimen, pathology specimen, we ask them to identify the specimen. Okay, identify the specimen, identify how you have identified what is that. For example, necrosis. So what are the points which will support your identification? That is a necrosis. Okay, that is a gross pathological specimens. Then, interpretation of lab reports. Now this also in RS3, importance was not there, but in RS5, I think Viva-Bosi, including 5 marks for lab report interpretation was there. But now it is, I think I don't know how many marks, just 4 marks. It's 5 marks. Now this is very important. Now, this interpretation of lab report for diagnosis and treatment purpose, what we can do is, please come back, what we can do is, whenever we are taking the particular chapter, bringing the reports at that point of time. Or your second section will start with the reports. Okay, creating an interest in the subject. You can just give the, make groups in the class and give a report and ask them to tell what is your understanding. And then from there you start. So now they will be able to relate to what theory we are speaking. All these days what we are doing more of theory. You have lots of reports and you can give the assignment to the students. Every family is having a disease. Every family will have a report. Tell them put a whitener on the name of the patient and if address is there, let us not diverse the details. Then because in future it can become an ethical issue. Okay, tell them to do that and get Xerox copies. Let them keep around 5 to 10 reports of different TSH, lipid profile and all that. Let them keep reading. Tell them in the beginning itself. There are certain activities which we have to give them sometime. Today or tomorrow you have to bring me 5 reports. Not possible. So in the beginning only you make a note. What is that my students should come prepared with? So you tell them, please, and even nowadays even help me, what is that? You get the slide also. HP slide also they give you along with the report. The tag they give that paragraph embedded. That is also paragraph. Okay. So anything you tell them, just don't say only this classes, students will also give them inputs. So start whichever name, what to say, see out of the class. Please make a point. And then you just ask for the informer to give it back. And then you can modify, fine tune it, and you will have a MEQ ready. MEQ is with respect to what? Clinical. So we are giving them a lab report. Then you can give them a clinical scenario. And then you are framing 1, 2, 3, 4, 5. And please try to see that you are framing questions of this order in your university level. Because we have 5 long questions. We just cannot keep on asking them 5 long questions. As sir said in the morning, very difficult for the students to finish the paper. And many people are complained in the first year, in Tamil Nadu, the exams are over theory, they are not able to finish the paper. That problem should not come for the second year. Even though they are first pass CBDC, let us try to make things easy for them because they are the ones who are going to the exams and not us. So keeping the mind, students are writing the exams, at least for 1 year, we need to put in the efforts as a team in the pathology department. It will become easy for the next batch. It is how it is. It's not very difficult. See, lesson plans was made compulsory. Everyone is made it like retrospectively or daily or future, we don't know, but something they have done. And it was projected to the mandate over the January 31st was the last day to upload. Everybody has spent their lives. We have sleepless nights at that point of time. But now, let us not have sleepless nights. Let us be well prepared. Why? Because we have joined here for that purpose. That's the main aim of this session here today. Going on. Okay? So this is about positive attitude. And we should try to, tell the student that pathology is not just exams, pass and learn. And they always feel it is a burden for them because there are so many branches in them. I understand. From their point of view, it is a burden for them. Okay? But we should try to tell them, have a positive attitude towards the role of pathology and microbiology in the medical system. Because we have what is known as the hobby practitioners. Practitioners who have not gone through the drill of 5.5 years in the colleges, but they are excellent students. Agree? All of you agree to this? Yes? Now, if our student happens to go and sit with them in the evening time to see how they are practicing, they will say, you have to see, this is how I am coming to the prescription. Is it clear? So the student will say, why should I study pathology? Based on this, I can come to the conclusion of morality. Yes. If a hobby practitioner is successful in our society today, it is because they have undergone all this exercise in their mind. Nobody has guided them, but they themselves, they were self-learners. Is it clear? They have that commitment, they have that passion. That I have to treat the sick people in the society, and that is what they have become successful practitioners. They may not have the knowledge of formula completely. They may not have the knowledge of formula, but they know how to use it. They know how to, from the history of the patient, they know how to convert the language of the patient into the wood, and they go and the one remedy is there, do the remedy of the patient is coming back. Isn't it? All of you are understanding what I am trying to tell you? So at the end of the day, it depends on us. It depends on the individual students. But our aim is to see that we are trying to help all the 100 students, depending on the intake, what we are trying to do. Maybe as the sir said, the way the graph will keep on going up and down, up and down. But at the end, he's going to understand what is that subject of pathology and what he is supposed to know at the end of the program. Okay? Now, organization of the syllabus, I go quickly. Now, this is how it is. You have a copy in front of you, so you know, go into the details. If you want, you can take a copy of it. Okay? Now, say features of CBDC syllabus. This also, I will not go into the details because in the morning, Dr. Munir sir has beautifully explained to you in a very nice manner the salient features of the CBDC syllabus. No, this is learner-centric structured syllabus. Clear expected competencies are there, and we are listing the outcomes also. The contents are organized based on the domains and deliver hierarchy, innovate, use various real methods and media to deliver the content in a better manner. Blueprinting is there, and learning assessment is also there. It is practice oriented when you go to the practical, and then learner accountability is there. Okay? And so this is about yes, in your state and again at the level of universities also, when the examination will be done. But they have to follow the calendar of fitness given by NCA. They cannot follow. They cannot bypass. The second year will be here. What is the duration? 12 months. Please keep in mind. If you want, note down the points. The duration is for 10 months. 10 months. 12 months. As per the NCA calendar of events, what is the duration of the course? 12 months. Okay? In that, 2 months you write down. It is meant for the process of conduct of exams and declaration of the results. 2 months. We are left with what now? 10 months. 10 months what? Every day we come to college. No holiday, no Sunday, no Saturday, no what is that? Nagapanchami, Ramalashtami, Ganesha Puja, Deepavali. Oh, in our state, Deepavali means 15 days. And we have all India quota. Man, Deepavali is very big festival. Please go. Okay? So all keeping in mind all these holidays and all that, minus 1 crore. College fest will be there, or some seminars will be there, some speaker will come, audience is less. second year बच्चों को CBDC क्लास है, no हमारे कॉलेज का प्रेस्टीज का सवाल है, भेजो जाओ, क्या हो रहा है? 1 month. So we are left with 9 months. In our university, we are left with 8 months. Because ours is a government institution. Madam, see, listen, government institution, we have second Saturday off, fourth Saturday off, all Sundays off, all GH off. We have a pattern. So we get only 8 months. But Dr. Munir sir has given this standard. I am very frank about it. Sir has given us this standard. He said, see that they do models for 9 across India. Let us try to do that. If not possible, 8 or 9. But you should cover the hours. Please, now this is a very practical thing. Please note it down. See, I am not going to tell you what is there in the syllabus or whatever. Practical difficulties which you will face, which you have to overcome, which you will have to tackle with your principals, your other colleagues, and then impress upon the university. You have to conduct exams at this point of time. Please note this. So, we will assume we will have 9 months. Okay? Now, how will you divide the term 1 and this one down to all these questions? Okay, but have they given you the time there? No. So, we are working. So, it will be term 1. It will make it 4 months or 5 months. Decide, all of you, make it 4. What I am trying to say is, my suggestion to you people is, because students are coming to pathology for the first time, it's a new syllabus. It's not a continuation from organ to organ and MM to MM. No. They will have some entry behavior, they will have some knowledge. They are only coming with the knowledge of physiology and anatomy to us. Okay? So at least all the things, the basic things, general pathology, general microbiology, general virology, parasitology, the foundation has to be very strong. You just cannot tell the students CBDC syllabus is there. Okay? Now I am only teaching you, don't ask questions, no doubts. 1 hour में schedule खत्म हो गया. You can't do that. And another one, please keep in mind, the number of hours 200 is the minimum number of hours. Please write it down. It doesn't mean that you will have to complete it in 200 hours. I am really telling you from my experience, I have never been able to do that because we have many practical issues there. Because in the beginning, we have to impress upon them the cell immunity mechanism, we have to impress upon them the information mechanism, because if they are strong in these aspects, next when we go to the next session, the term 2, we can do lot of assignments to the students and the portions also can be completed. I'll come to that when we go to how to go about the syllabus. So I think it will be better we keep it for 5 months as the first term. You please do this exercise. That is why I am forming the WhatsApp group. All of you. Okay. First 5 months will be term 1 and the next 4 months will be term 2. Now, is it easy for us now? Yes. Now, in term 1, you see what I have given? General pathology. module 1 will be means what? How do you understand module 1 first month? Say for example, the students are coming, please don't be interrupting. The month of October. Month of October, second Gandhi Jayanti will be there. Okay, third session will go. So 3rd to 31st will be module 1. Understanding? You have to put it on paper. You will do the first you do for the first month, second month, ऐसा लिख लो. And you are preparing as soon as you go. That is the first come. यही करना है. ठीक है? Now you know that now the notification will come from the office. Second CBDC batch will start on this day. Now module will be from that day to the end of the month will be module 1. Then subsequently it is easy. So maintain your records as module 1, module 2, okay, 5 modules. And then after that, 50 hours of pathology, general pathology will be there. You will have to do justice to everything now. It's not that now all this is what pathology teachers used to do. First I will finish pathology. Then I will go to systemic pathology. Then I will learn what to do. Microbiology I will start. Then I will finish bacteria. Virology and introduction I will do. Then I will go to viruses. Parasitology is very easy. Students can study on their own. Just do introduction, open data. This is not the way now. You will have to include everything in term 1. See that you are starting with the introduction to pathology. Okay. Please listen. Introduction to pathology, and then you see how you will use cell injury, inflammation. Try to do it simultaneously. If you have 2 people in the department or 3 people in the department, depends on how many staff is there in your department. Don't wait for cell injury to be over. Don't wait for inflammation to be over. But don't start cell injury before introduction to pathology. This we have to keep in mind. So start with introduction to pathology, okay, and then go to cell injury. Either HOD takes, I'm just giving you the example. HOD will start with the cell injury. Cell injury, कल associate को दिया अपने class, he will start with inflammation. Or wait for 1 week. Depends. We all have the knowledge. Okay, cell injury also. Why? Because etiology of cell injury common, either etiology of inflammation or the other. So maybe wait for 1 week till we finish with the etiology and pathogenesis of the different aspects of cell injury, and then ask your associate to start with the inflammation chapter. And you see how many hours. And again, it depends on how the students are grasping what we are telling. We just cannot finish it. Please don't do it. At the end of the day, the student should understand what we are trying to do. Let us not put the pressure of CBDC on the students now. Let them feel the subject. Let them learn the subject. Let them be happy learning the subject. Let us not tell them to CBDC. Don't fret them. Don't tell them anything. Okay? So, and simultaneously, please start. What is there? At least for 1 month, I think you can go ahead with this. Cell injury and all that. Okay? And then in the second month, and human microbiome also, I think we can bring it to the first month. Human microbiome, put it on the second floor. Okay? Now you have introduction to virology and then introduction to parasitology, introduction to microbiology. ये भी simultaneously start. Simultaneously. All introductions simultaneously. But first finish off with the pathology. Okay? Go to the cell injury. Then start with inflammation. Then go to introduction to microbiology. Because we have to start off with introduction of microbiology. Everything is there. That is the structure and all that. Okay? As we are going for a few hours, we are finished. Begin with the introduction to virology. Because students will be able to relate now bacteria and viruses. Okay? After you have started off with the virology, start with introduction to parasitology. So they are able to relate with all these organisms. It will take some time to do the, what is that? What is? But you can do. You have to put in efforts for that. Okay? But after you do, it is not that it is a watertight compartment, you cannot do anything about it. You can be flexible. Don't be very harsh on yourself also. Don't feel guilty. Oh,
theory हो गया, somebody has done और मतलब Monday, Sunday को आज पूरा खत्म कर दिया. You see, method of sterilization is there. Try to see them. You sync it with sterilization and disinfection chapters. Okay, at least in that way. At least in that way. Okay. Then even the demonstration of instruments also. The demonstration of instruments, the list of the instruments have been given. I think so. Now the list of instruments has been given. When you are planning your modules, you can just bring in the instruments. So don't do it for 2 hours. Bring all the instruments, put it on the table, then start. Again, until and unless we don't do this, synchronization, students will also not understand that this is CBDC. They will not find the change at all. They themselves will talk. Madam, CBDC. What is the change? They will discuss with their RS5 people. RS5, you can see their Sarada. And let me tell you, their seniors are gods for them. You tell them whatever you want to tell them. Because they are, why? Because they are the ones who are writing the theory exams, not us, sir. They will tell, Nadu, like this only. See, I filled all the pages, I got 80 marks, so fill all pages. They will listen to them. They will not blame them. See, I'll give you an example. In our college, RS5, I told them, very specific answers for 3 marks you have to write. Even if it comes for 1 line, you will get 3 marks. They didn't listen to me. Senior ने पास सुन गया, एक पेज पूरा. In our college, in our university, booklet is 60 pages and question number will be written. Question number 1, उधर लिखने हैं. ठीक है? तो fill all the pages. Result क्या है? Fail. Back. I said, did you follow my instructions? No. I filled all the pages. Who told you? My senior. You got to follow only. What I should do? सब बोल के थोड़ी होता है. Take the Xerox copy. 500 rupees there. You got the Xerox copy and to the point, Shazmi. See what I tell the students, because I know they're going to listen to the seniors. I tell them what is asked to write first. And for your satisfaction, you want to fill the page, fill करो. दिन भर एक बार ये ले जाएंगे लिखो. But write it to the point. Here, she has written everything except the answer. All 3 marks are like only. What I tell my students is 3 marks to the point. You write 30 marks in your pocket. So don't listen. Another understanding is how much ever we write, 3 marks will not be given, 2 will be given. How much ever we write, 5 marks will not be given, 4 marks will be given. How much ever we write for 10 marks, 4 marks is 7. Then I ask the students, 3 marks किसको? बाबा फ्लैगशिप? 3 marks किसको? What does the teacher know? They will not know. I said, 3 marks for whom? This is what is there in the mind of the students. You understand? So you please tell them 10 marks. This is what is expected of you. Right? You will get the marks. And please, even you people, when you are evaluating, don't be stingy giving marks to the students. They have written all the points, 10 out of 10. Give them 5 marks. All the keywords are there. They have understood. Give them. Why are we not giving? Why? Because our teachers did not give us. That understanding will be there. No, but now this is entirely different. Why full marks? Curriculum. No, let me please. See, you have to be very assertive. It's not that we become arrogant and all that. We need to change their mindset also. अगर ये बुला रहे हैं ना, तो उनको बोलिए सर 10 marks NCH वाले रखे हैं ना, why are you calling us? 10 अच्छा लिखा है बच्चा, हमने 10 out of 10 दे दिया. Why you are asking? I am the subject expert. You are not the subject expert. Why are you calling us? You need to be vocal about it now. You cannot listen to what you see. Even your board of studies will be there. Okay, faculty will be there, dean will be there. I am the dean in my university. I am streamlining everything. I am what to say? Because I know some of the teachers are little comfort zone. I am making them come out of the comfort zone.
dilation we are laughing. Cholesterol is in North America. Somebody heard it. Cholesterol is found in North America. Then we start. And हमारे पेपर में क्या था? Ladies. They had 10 mark question was there. Pathogenesis and all that. But starting sentence क्या लिखने का पूछा? Rabid dog bites human लिखना है कि नहीं? नहीं. Human bites rabid dog. I was like stunned. ऐसा भी हो सकता है क्या? If a man bites a rabid dog, pathogenesis शुरू हो सकता है क्या? Because we people are always interested. Who knows? I got up from that place. I didn't tell anyone also. I went to my chamber. I took out this one. Something note exception. Please focus. Now this is called as the content mapping. Serial number 5. The content mapping of the syllabus has started. Is it clear all of you? So from here we call this as what? Content mapping. It will end with the practicals. Content mapping will end with the practicals. In the first one, so that is what? 5. So the numbering will be now 5.1. Now 5.1, it indicates the unit or the chapter. Unit of chapter. All of you understood? Yes. Everywhere it will be 5. You go to micro, parasite, whatever. Only this number will keep changing now. 0.1. Okay. So 5.1. That is what? Chapter. Introduction to Pathology. Okay. Next you go. It will be 1.1 now. Understanding? Numbering of the SLOs will be 5.1.1. But they will not keep repeating the 5. They have followed a particular pattern there. Only which will be taken? 0.1 is taken. It is actually 5.1.1. Then you have 10 SLOs, it will go till 5.1.10. So this last number will indicate what? The SLO. How many SLOs we have formed in the particular chapter? Okay, how many are there in introduction to pathology? Please all of you. 3 SLOs, that's all. SLOs कितने हैं? 7 हैं. Understood all of you? It is 0.7. So what does 7 indicate all of you? 7 SLOs are there. Understood? This is what we need to tell your students also. See there in this curriculum, we have not allotted time. How do you make the students aware of the curriculum? But we will have to 200 hours per week. Because if they do not know how they go through the syllabus, it is not. It will be a failure. Now, lot of talking is happening against this flow. I cannot shout until I stop talking. Last bench. Madam, we need to acknowledge this. We need to accept it. जब तक आप accept नहीं करोगे, position change नहीं होगा. And this is what students will also do. But you should have control. As sir said, section 144 के जैसा नहीं है. You need to have control. Now, madam, hours का I will not talk now. Some people talking about hours. I will not talk about it. क्या होता है? Deal होगा. Now 1.1 से लेकर कितना है? 7. So 7 SLOs are there. All of you understood? Now go to our next example. Take up the next topic. Cell injury. Now go to cell injury. Now tell me how many SLOs? Quick. Don't talk. Focus on the curriculum. 59. Yeah, all of you understood? All of you understood? We have 59 SLOs. Understood all of you? Now when I come to your point, cell injury, how many hours are allotted? Please look into 10 hours. 10 hours. So in 10 hours, you will have to complete 59 SLOs. Again you see how many SLOs you will include. 3, how many hours? 10 hours. I think we can finish. Sometimes what will happen if we have vernacular language students also, we need to cater to them also. Extra 4 hours हो जाते हैं. No problem. No issues. हाँ.
So 59 SLOs we have completed.
It depends on the students. Yeah. But basic कितना है? Minimum 10 hours लेना है. Salary को. All of you please keep this in mind. Minimum 200 hours you have to complete. अच्छा है ना? अच्छा है. You can do online also. See, try to be flexible, but try to do justice to the SLOs. Now let me tell you one thing. You know, SLOs, this is the first time SLOs has come. All of you listen. A range में कौन सा syllabus भी नहीं आया है. Only CBDC has come into this range. Things have been made very easy for the teacher. Okay. Now the SLOs which you are seeing here, they have been क्या बोलते हैं इसको zip किया है. क्या बोलते हैं इसको zip file. अभी ज़्यादा थे. I was the one. No, I was the one who edited the. I had. You should see my SLOs. Because it will be a guide for a new teacher who is coming to teach pathology for the first time. So you should know about this. This guidance I never had when I joined in 1995 as a part-time teacher. But I used to work. I used to know people. Okay? So you should not have any issues at all. Everything is there. It's something like a buffet system है. But buffet system में जो चाहिए आपको हम उतना ही देते हैं. But यहाँ पे सभी देते हैं. And how you are going to take it, and how you are going to digest it, and how you are feeding the students, and how they will digest it. That is the role of a pathology teacher. Don't panic. Cool, calm. We will do it successfully. Okay? And our main aim or vision for the second, the BHMS CBDC pathology across the country, 100% is unachievable. With this kind of a curriculum. I have done it for R.S.Gopika syllabus in Bhartiya University. I implemented everything. My way of teaching and all was taken as a pilot project for me in the university. I implemented OSPI, I implemented Viva Path system. We made the external examiner also because the Viva Path system, we took the feedback from the students. And I prepared, the students were made to write a preparatory exam 15 days before the final exam. And I was just waiting, my fingers crossed for the results. Usually in our university, the results are announced by 8 o'clock. It's tax. I don't know, that is the day of announcing the results. In morning, I announced it, or announced it. So 8 o'clock, the portal was open, and the students started putting the messages because I had created a students group, I had created a parents group because they should not miss the classes. That is another criteria. Otherwise, they will not understand. So parents also were made to realize what is the importance of the curriculum. Students were made to realize what is the importance of the curriculum. It was a tight-packed curriculum of technology. Nobody else was doing it because, as I said, it was not a compulsion at that point of time. Now it is a compulsion for us. Okay? And till 1 o'clock, I was getting the messages. I only told the CR, tell me the failures. Madam, I'm not failures in my around 80 students have taken up the exams, and I told her, you yourself enter the register number and try to see because they may send less. Then till 1 o'clock she said, madam, I have not had my dinner also. I have sincerely gone in and not a single student has failed. I said, sure, ma'am, please ma'am. I said, okay, thank you. Then I again waited in the morning, I just said, any student has failed. Because I tell my students, whether you pass or fail, please message me. If you fail, I will try to find out what is the problem. You may not have any tension, anxiety. Okay, nothing to worry. Carry on system will be there. So there was no failure. And usually in Karnataka, Pathology college you have heard of. Pathology college is the best college. And they always have 100% results in first year, second year, whatever, third year, anything 100% results. That year what happened? 2 students failed in pathology. And my college, Government Homoeopathy Medical College, 100% results. Okay? And some students had gone to court or something, I don't know. And then the 10 marks grace came into picture. 10 marks grace, I think even in your university. And the marks were distributed, if they fail in this subject or whatever, and benefit to the student. So, what happened? Because the grace marks were given, Father Pune 100% time had there, Vidyapeeth college 100%. So 3 colleges 100%. But I feel proud to say that without grace marks, my college topped the list. Usually I used to have 4 to 5 failures in the college. Okay? So that confidence I have. And even here also, and they are not much should we not have 100% results across the country and create a record in the medical field that pathology 100% results across the country, which even the MBBS people can do. We can do it. It's only that we feel we are a little less, we are not cooperative, we are no efforts, and but let me tell you, whatever I teach in my college, the students, they can have friends in their, what to say, other colleges also. So they sit across in the holidays and all that, and then they're studying, especially the immunology. They say, what is this? Beautiful, such clarity is there, so much clarity is there. What is this? This is not madness. But then, their HOD will come to one system. 1 hour because we have a system. So, see, I don't want to comment on that, but what I'm trying to tell you is, you want to work at excel. First, what we have to decide is, we should become a better version of ourselves first. We take the best version of the mobile, right? Version क्या वो Samsung को 10 करते हैं, 14 ना लेते हैं ना लेके जाओ iPhone वैसे ही ना इधर का बड़ा TV हमारा first. You see, if you simply go talking to the students, they will not listen to you because you are not talking to them. If students will listen to you, if you tell students, record notes, you should also have notes. You should also have prepared the notes. You should also have prepared the PPTs. Then only the students will believe you, they will have confidence in you. You say something, you do. Students will not listen to you. And then we think that the students are not listening to us. First we need to change ourselves. Okay? And what we talk, what we do, what we expect the students to do, first you should. What is this? You are not getting up early in the morning 5 o'clock. First, you get up early in the morning 5 o'clock. Okay, you are not going for a morning walk. You go for a morning walk. You do jogging. You do yoga. Whatever you tell the students, we should be a role model for the students. Otherwise, students will not listen to you. Okay? If you tell the students, hey, you have to be fit there. First, you be fit now. We cannot be overweight and tell, what is this? What is this? No. We need to. Madam, it is from every aspect. Every aspect. We are not just delivering the curriculum here. We are a role model for the students. And we have to, it is not just putting up a face there. It is, we are not actors. We are not acting. एक दिन act करेंगे ना सीसे है ये वो the computers student will but that day you told me this today you are telling me this now the students are very very bold. What is and I really love that. I don't shout at students when they talk just like that. See, make your students to face life. The curriculum of curriculum. This is something different. Something new. They are very scared of the exams. They are very scared of the syllabus, results. You tell them, see, we are doing this so that we are doing this to make things easy for them. And but one thing you please realize, all students cannot score 80%, 90%. We will have all the areas there. They may have 50%, 60%, 70%, 80%. We should appreciate the 50% student also. We should appreciate the 90% student also. But at the end of the day, we should see that we are training them how to face life. If you do not do that, CBDC is a dynamic curriculum. We believe in the vital force, which is dynamic in nature. So their life also should be dynamic in nature. Whatever they face in life, whether they get less marks, tell them yes, you will face it. Not just sit there and try to feel guilty about it. Oh, I did not study. If I had studied, no ifs and buts after the results are declared. Teach them how to face life. It is not only just the, what to say, the knowledge. Nowadays, everybody has knowledge. Everybody has knowledge. Right? You just open the mobile, at the click, how much knowledge you want. Knowledge is there available. Whether you teach them silently from the Google, they will understand how many lectures you want, how many people are coming there. They are all lecturing, YouTube channels are there. Some people go like Dr. Najib करते हैं. Beautiful. They will go there, but they have to come to our parliament. They have to come out to our classroom. We are talking about the chapter. We are talking about the SLO. Everyone clear? If you go to the next one. Yes. Okay. Now, this is the domain competency to be read as you go to the entire syllabus. Any other letter is there apart from careers? Let me know. Just flip to the pages like this. Start the page. Yes. It is theory. If you go to repertory or if you go to SPM subjects, okay, clinical subjects जो होता है ना, all this is remaining things. You please refer other subjects also. ठीक है? Okay, KS मतलब theory means we are going to question them in the theory only. You cannot ask psychomotor questions. You cannot ask practical questions. They are very clear. Okay, so when you frame the questions, please make this point. Now, is it clear? Domain competency, all of you? Yes. You know the domains, no? Cognitive, psychomotor. कैसे नहीं पता है ना? Scholarship means they are developing that, what to say, next level. It is, see, let's say for example, now here is only definitions. You go to the next level, what is that? What to say? Cell-injury, if you do many things are there. Explain the mechanism, explain the pathogenesis, all is explained, described, you know, that will come under people. It is not just definitions what students will do by. But your mechanisms जो होता है, even etiology they can learn. But mechanisms they cannot by. Because the funny concept is what will happen, the entire sequence will be lost. So they need to understand. It is the next level of the cognitive domain. So that is called. Okay? So that is why you put both there. Now see here, define the term pathology. But he is going to study so many things in pathology, general pathology, systemic pathology. There are also so many things are there. So he is going beyond knowledge there. It is not just understanding, it is not just by-hashing. Only when he understands and is able to put it in his own words, we will call that as scholarship. So now the next one is K. That is a Miller's competency. Now mapping of the specific level of specific learning objectives to Miller's pyramid. So in the morning sir showed a beautiful diagram, Miller's pyramid. That is understood as to be read as K knows. KH knows. Anything else is there in the book? Just flip through the pages. See, I will tell you what you can say now. Please understand. All of you can see here. If it is K, it will be C1 in the Bloom's and Gilbert. Understand this? All of you. Okay? Because it is just recall. It is C1. If it is KH, you see what is here? C2. And C2? Everywhere. Everywhere throughout the document or the curriculum, K matlab here it will be C1. If it is KH, it will be C2. If it is knows how, means what? Describe the mechanism. Describe the etiopathogenesis. Describe the action of exotoxin molecule. Understood? So that was interrelated. Yes. Now what is this next? So let's go ahead. Now next is the content. Next is the content. What is the content? You will write as the content of the specific chapter and unit. Again, flip through the pages. It will be the cell injury. Okay, in cell injury we have different what to say headings. In cell injury, what is that? Etiology can be there. Etiology can become a content. Mechanism can become a content. Ganglion can become a content. Necrosis can become a content. Intracellular accumulations can become a content. Understood all of you? Yeah. So in that, let's say for example ganglion. Now you go to the chapter of ganglion, go to the headings of ganglion, follow which textbook you will follow again. End में which books are allowed, that only you have to refer. You cannot refer something and say and explain Start your class with the objectives. At the end of the session, please write down. Please write down. At the end of the session, you can use the word learner or you can also use the word student. It is better we use the word learner because they will also feel happy. Madam is not thinking as students. At the end of the session, the learner should be able to put a colon. Okay? Should be able to get हो गया 2 के बाद colon डालो. अब नीचे आ जाओ. Number 1 क्या लिखोगे? Define the term pathology. Write down. I'll tell you. Define the term pathology. Number 2. Define the term pathophysiology. Define the term health. Next. Define the term disease. Next जाओ देखो क्या है. Next, state the branches of pathology. Next topic you. I'll give you one thing. Okay. Next, and you should number them. No need to number also. You can just put a line or a dot. List the see all the SMOs you write there. List the contribution of important scientists to pathology. Okay. Next, enumerate the common terms for the study of diseases. You see whether you can finish this in 1 hour, and you see what is the number of hours allotted to introduction to pathology? 3 hours. I don't think we need 3 hours. You understand? Some mistake I have because this our system I have not done, madam has done. So no problem. You can just shift those numbers to sedentary information or whatever. If you are able to do this entire thing in 1 hour, no problem. Understand, madam? All of you? Yes. Introduction to pathology, you can do it in 1 hour. That is what I think. So all these 7 SLOs you have filled. Okay? So
16. 16. Another one, 15. Come to 15 also. Describe the sequential biochemical adverse changes in irreversible secondary due to ischemia and hypoxia. Actually, I think it is repeated here. Actually, it should be reperfusion injury. This is what I'm telling you. Your mistakes are going to please make a note of it. Now I got it. Now the first one is correct due to ischemia and hypoxia. Next, it should be reperfusion injury. When you go to reperfusion injury, there are three things that are coming up. Hello, listen. Three things are coming up. You take this and put it as LAQ, one case. 30 marks का हो जाएगा वो. So there we have to be little alert. And if you are becoming the paper setter, please try to break up. No problem. Understood? And when you are teaching the students, tell them SLO ऐसा ही रहेगा. But in the examination, it can be broken up. Split हो जाएगा. See that understanding we should have. And when we are thorough with the curriculum, then only we can understand all these minute aspects. Otherwise, we will not. We will simply leave that question and put there. It will become 30 marks. Student write. How many minutes, sir? You should write 10 minutes, sir. In 15 minutes, you should write. Give it a half an hour. And then anxiety will start for you. Madam, we have seen that. Nowadays, the two electives are there. All of you agree? Students क्या करते हैं पता है? They keep it in the end. They don't attempt also. Some people don't attempt also. Now neglect है. What electives? And now we have 5 electives. So try to do justice to that. Is it clear all of you? Yeah. Now next is what? Now this I have told you. C1 Blues and Gilbert's level to be read as. Now it is a C and the first next letter is 1. Roman 1, 2, 3. Okay? So to be read as first alphabet refers to Bloom's domain. Cognitive domain, psychomotor domain, affective domain. In pathology, entire theory will be C. Psychomotor practice. Okay? Now the Roman number refers to the Gilbert's level of learning. 1, 2, 3. I am mistaken. 1, 2, 3. 1, 2, 3. Okay? Okay, now say for example, C1 is again knowledge. By heart. He will by heart what is different pathology, he will by heart. He will simply write, he will not even understand. But when it comes to the mechanisms, he goes to the next level, C2. And he will see, and now with this knowledge, he has to identify the specimen. He has to identify the histopathology slide. And understand the changes in the slide. That is for the next level. It will go to the C3, but he is doing it with the psychomotor domain. When we go to the skills, everything will come down. It is not totally skills. When a person has to do a practical, he should know the theoretical aspect. It is cognitive domain. He is doing it, psychomotor domain. How to do it, affective domain. So everything will come together. Okay? Understood? So now, the priority. Now this is, we are trying to divide the entire syllabus into 3 columns: must know, desirable to know, and nice to know. Now this is where this will start from the first year to the final year. Now say for example, they learn what is that? Hemoglobin in the first year. Now structure of hemoglobin will become what? Must know for them. Functions of hemoglobin will become what? Must know for them. Functions. Now changes in the structure of the hemoglobin, we will not teach them that. They will come to the second year, they will learn. But it may be desirable to know in first year, or it could be in the last column also nice to know. Okay? When they come to the second year, the desirable column will shift to the furthest to know. Nice to know column will come to the desirable. Understand? Now the same student goes to second and third year. Nice to know will come to desirable. Desirable will come to, so the shifting will happen as they go into the next level of learning in the same course. And this, how do we categorize this? It is again categorized on what is the frequency of the diseases in the society.
students should know, they have the right to know the curriculum, they have the right to know about the examination pattern, everything. Why the students are going to the court? Because they are finding the changes are there in the NCH regulations, and at the level of the university we are bringing in what is known as the ordinance. So there the gap is happening. A gap only they just slip through and go to the court. It has happened in our university. And university will always keep cutting the certificate there. So now they have become very strong. They said they told me, madam, this gap should not be there. Please see that this gap is closed out. So the students don't go to the court. And university people, usually friendly student, they are going to the court. So more than the class, then you also please keep in mind, this also we have to be very careful. We have to empower the students. We are not instigating the students. The words are very important. You are not instigating the students. You are empowering the students with the knowledge. But they should use that knowledge to gain pathology knowledge, write the exams, pass, and then go to the next year. That's all. Not okay now. Now teaching learning methods. You want me to explain what is our explain? Next month is the exam. September is the exam, so you can do it in August. Picture down, picture. Because we have finished almost all the diseases. All the organisms also we have finished. Okay? Now, in problem-based learning, you give them a problem. What is that problem? Case-based learning नहीं ना? CBDC problem. Tell me anyone. You know the answer. Problem. Reverse that from it's a problem. Reverse. It's a problem. Values are abnormal there, I guess. And don't give them the range there. There you have time now. You just cannot give the report and give it to the student because in all the lab reports what is there, standard references. We should not use the standard references to the student. You have to type or you just keep a paper and xerox it and give it to the student. Yes, sir? Now, say for example, anemia, sir. Anemia patient. In your lab, hospital, every one of us are having. So you can tell the technician, but whenever they are having very abnormal values, please keep an extra sheet. They take the sheet and give it to the patient. No? You tell them, madam, xerox it. I want. But we should know what is the detail. And to know that what are the details of the case, it could be a OPD case or it could be a IPD case. So you tell your PG students or you tell your students or the secondary students, they will be going to the, what is that, clinical classes simultaneously they will be going. You can tell them this case is that, please go, take a brief history of the case. Or you, I think PG students will be giving the help of PG students. So now you are having it. Okay, so you have the what is a few lines of history of the patient and then we are having the revisions. So now the student should be in a position to tell us what could be the probable diagnosis. Not much of a difference
one case
Ma'am,
is
so
given.
it is not related with remedial teaching. I was under the impression that any problem
That is tutorial. That is tutorial. Okay? So beginning में क्या कर सकते हैं? We can take that only and test it. And we will finish off whatever allotted. कितना है वो? 6 hours है. तो 3 PBL लीजिए, case based पे लीजिए. And we have the reference book is also there. क्या है वो? Practical का model. There are also many things are there. You can refer what to say CBDC, MTS curriculum. There are also many examples of this. So now, what is the thing here? Once we get into that, automatically the ideas will come. And you will have 100 PBL and 100 cases. But what you can do is, if 100 students are there, please listen. 100 students are there. Yeah, you can make them to groups, madam. 25 students. And for each 25 students, you can give 1 PBL. Okay, तो कितना हो गया? 4 हो गया. Same way, CBL कीजिए. So we are done with the 20 hours. For group discussion again, try to bring up some what is that? Again question. All these things please keep in the end only, not in the beginning. No, because I don't have the basics. Basics they are not supposed to know. Okay, group discussion. What can happen? Take the same PBL and CBL and ask them to do the group discussion. Because some may say no, this is anemia. Some may say no, this is polycythemia. Some may say no, this. So let them come up with all the ideas. Make the students to stand, make the list. So 4 groups, 4 columns teaching. What do you think? What do you think? And you see, I'm really telling you, they will come up with so many ideas. I've done this. Okay? Only because I didn't know that it was PBL or CBL. We are all doing the procedures. Technically, even you are doing it. But we didn't know that इसका कुछ नामकरण है. सभी कर रहे हैं. We took quiz also. In between only, suddenly sometimes what will happen? Last bench there will be sleeping. Suddenly put the quiz line. Another format, not the PPT. You have a thing ready there. You just say, what are you doing? Stand up, answer this. Then they will go, oh man, you will not do this. We have to be alert. And usually हमारा timetable कैसा है खाने के बाद. Only 3 to 4. That way, my students are alert. See, usually, how you should, I'm not saying it's a competition or whatever. You should try to keep the students' attention. And the students' attention, how it is possible, what's the student. And all these I have been doing. One is I have the advantage of being mentored by sir, that is one thing. But only mentoring is not sufficient. We give you the idea, but how do you implement it in the class? Sir tells in the morning session, sir, bring some activity, bring some visual. Also visual out here. Shahrukh Khan ka, Salman Khan ka. Okay. फिर किसका last dance?
जो यहाँ के ऊपर है वो जमाने
नहीं, मतलब visuals and all expressions where you think about. And when we are in
यूट्यूबर बनना है यूट्यूबर बनना है यूट्यूबर बनना है हमको इंस्टा पे ये जो भी आप बोल रहे हैं हम यूट्यूब पे डालते हैं हम ये करते हैं आपको रिकॉर्ड करके यूट्यूब पे डालते हैं हम रील बनाए इसको पे आसपास तो एक प्रोसेस चली आवर्स
for 20 hours. No, good idea, madam. Let it be innovative, madam. Another one thing, see, madam, if the students are giving you ideas, please take it and ask them to do it. No, if they are joking, no, even if they are joking, be serious. Very good idea, implement karo. No, don't take what you are talking. No, don't. You will have some idea because let me be very frank with you. I do not know much about Instagram. I am not on Instagram. I am not on Facebook. Okay, on Twitter. Because I am a government official, I don't want why all this is.
some company one song is there if they taught me I never
You probably like that. Understood, sir? You raise the question, madam. Sir said in the morning, all of you, raise from me.
earlier in the class, you have followed all the lesson in the becoming undressed. You have taught them as per the SOPs, but you are just trying to see whether they are undressed or not. And so this again, just do it for 10 minutes, 15 minutes, not more than that, because you have the other purpose to come. And then record them, take the geotag photo. Please always remember whether the NCI is asking you, whether the GCI, don't do things because someone is asking you to do. All of you please listen here. Attention please. Don't do things because somebody is going to ask. I will take the photo because it is demanding. Criteria will have geotag photo demanding. I have all the recordings even before it became compulsory in the training list. I have it. In my college, the first year teachers were panicking. My God, we have to do this, we have to do this. I said, well, you don't do it. It's so very easy. You understand? It's just very smooth. It's something like, learning a cycle or learning how to drive a car. Starting with our music focus, the whole body will pain. We have to do this, we have to do this, break, accelerate, but afterwards, what will happen? You will put on the music, you will talk with everyone, you will talk with friends, right? Because you have gained the expertise. You understand? Once you gain the expertise, then you will do things for yourself. You will not want instructions. That is what I tell everyone in my college also. And because I am the dean, I tell all the faculties in the Karnataka state, do things in a manner where the university will look up to you as a role model, and they will say, look, government homeopathic college is following, go and see. Low level to come down. Until and unless we don't do that, students will also be like, we are also Yaka Raja. See? So I do the video recording when you are doing the demonstration. Okay? Do the video recording when the student is performing the experiment, and ask them only to do, and then tell them, they will do very nicely. You should first do the recording and then the sentences, typing like a dala, step.
Captions.
Very beautifully. I have them. I will just give you examples of videos in the video. They will do it. And when we are doing the practicals, I tell them take a pic of the slides. And then they will come to me. Then I will tell, okay, enlarge your resume. Then we say round karo. अच्छा ये agents है. ठीक है? ये granuloma है. ये lymphocytes है. I tell them, okay, इधर aromat लेके आओ. इधर लिखो. You just guide them. Technology किस तरह से भी वो करेंगे. And this will be circulated. You create a students group. WhatsApp group. Please listen. Create a students WhatsApp group. Practicals में जो भी हो रहा है, put it simple. एक batch आ गया ना, put this for the entire group and tell the our teacher will be there. Now the teacher will tell, open your mobiles are allowed in the class. Open it, go to the group. You have to tapping these circles. You see, this is how you have to identify. So they are seeing it there. The same thing they will see under the microscope. That's all. See, we will develop. It is not there in the curriculum. Have I put it there in the curriculum? So this is what step 1, step 2. No. These ideas will come to us. And why the ideas will come to us? Because we need to excel in our teaching. There is no end to become, what to say, very good. There is no end for that. Madam, we want to do for the people. Madam, person. Madam, person. Then madam, the photo is good. Photo is
video है.
photo is smile.
So those hours you can adjust.
Yes, sir, yes, sir. I think half an hour is also sufficient, sir. Half an hour करो मैडम उसको, half an hour करो, 1.5 hours. See if you can do it somewhere else. See we can be flexible. 3 hours क्या करोगे human microbial imposition रहते क्या बच्चों? देखो, understood how? Yes. अब क्या है? Anything else? क्या बोलो? Please, lecture तो आपको हम कर रहे हैं. ये वीडियो रिव्यू है. Two team teaching, understood how to do team teaching in pathology in our student. You have HOD, you have assistant professor, you have assistant professor. Okay? Now 3 of us are there. Do team teaching for integration. Likhो. Do team teaching for integration. Yes sir. Yes ma'am. Because I don't think other department will come and do. They will not. मुश्किल से मैं ये तो और आके टाइम में उनको ज़्यादा सो ओवरलोडेड उनको फर्स्ट CBDC भी करना है, सेकंड भी करना है, ऑर्डिनरी मेथड भी करना है, so they will find it difficult. I feel just for integration. Plus हमारे कॉलेज में ना PGP. Please listen all of you. Do team teaching for integration. How will you do? एक chapter उठाइए. Go to page 27. Please all of you listen. Sarada, please. 27 page number what? What? Young point 3.33. Yes sir. Get information. ठीक है? Now. Correlate the events of information. Listen. And outcome of various types of information with miasm. And representation is referred to a different material medica. एक लेक्चर हो गया ना बच्चों को इन्फॉर्मेशन स्टार्टिंग में बम्बार्डिंग कर दिया, टेस्ट भी हो गया, कंप्यूटर भी हो गया, सभी हो गया. नाउ वी आर डूइंग दिस इंटीग्रेशन एंड डायरेक्ट कम्स एंड स्टार्टिंग नाउ एंडिंग ऑफ द इन्फॉर्मेशन चैप्टर. सो आई एम द HOD. I will do the correlation of this one with the miasm. Take up the 3 miasms and tell them how in each miasm information is seen. I finish my part. Do it for 10 minutes. Don't full lecture because in second year miasms chapter is not taught to them. So let us not bombard them with the but we just tell them ABC बोल सकते हैं. We can tell them. We are not telling them the friend paragraphs. Paragraphs let them put the idea. All of you understood? Just tell them soric information, psychotic information, syphilitic information, tubercular information. How the patient will present at the physical level and at the mind level. Simple. Don't do anything. मेरा काम हो गया. My assistant professor will talk about how information has been represented, means what rubrics in repertory. Either take one repertory or whatever repertory is there for them. So we need to talk to the repertory department. Second year में कौन सा repertory पढ़ा रहे हो? तो from that repertory, take up the rubrics which is indicating information. And that's all. And what are the remedies? So my assistant professor will do that. Assistant professor give material medicum. Material medicum they will go over the details. Say for example, acute inflammation, belladonna is indicated. Subacute inflammation, what is indicated? Chronic inflammation, what is indicated? Suppuration में कौन सा remedy है? हो गया. क्या team teaching हो गया हमारा? Understood all of you? Yes. Simple. If you are other departments, they say no, we will do. We are very happy to comment. But if they say नहीं, we are overloaded with work, हमारे हाथ से नहीं होगा. We make a only for 1 hour in the entire 10 months. No problem. कौन सा topic है देते हैं? And this you have to do before you start the lectures. Integration कौन से department के साथ everything timetable you have to type it and give it to the other departments. And what you are going to do. Is it clear? Panel discussion I think we do as for the second year students. I think let them do it in the third year. Okay? Or panel discussion can be done with 3 of us also. 3 teachers can sit and we can
Integration 178 lectures are there for integrated teaching. So do we have to conduct all lectures in full syllabus?
One is we will do it or you will call the students. 5 students are going to example in the morning. That is my focus. 5 students you select for team teaching. You can give them
Symposium. What is symposium? You can do it in pathology. Can you do it?
Yes.
But you need lots of preparation. You should decide which are the topics you will do for symposium. This. Everything you have to sit with your department people and finalize. Okay? At least finalize.
Then you
Because we are looking.
tell the students to talk about.
Yes, sir, but we have to guide them.
I know.
Talk, which one, sir? For symposium.
Symposium.
Yes. We can ask what is symposium and seminar? What is seminar? In seminar, the entire class will not be there. Whoever is participating, only those will be there. Is it feasible for second year to do that? No, it's not feasible for us. So what is the context which is feasible for the PG students? Or it could be feasible for the final year students?
No, instead we can focus upon
Here
the
we can do,
symposium.
but it is only 10 students. What about other 9 students? Where will they go?
And so in that case we can focus more upon symposium.
Yes, sir. So that is we focus on all of us. All of you agree? Yes. I'm asking you, we focus on lecture, teaching, panel discussion. Panel discussion, teachers have to say. Because we have more knowledge than that. Then group discussions. I think for panel discussion, we can involve the PGs also with the permission of the PG department. Because they will have knowledge. I think that is a good idea. Brainstorming you can do. यहाँ पे सभी बोल रहे हैं. And once we start teaching, we should always take up lecture only. Because we want to fix the portion. Let us try to see. But this we have to do for practice. And now this sir has told, I will not go into the details. For MDQ and SDQ. I am coming from the
Vertical means from first, second to the
First year syllabus, second year syllabus. Horizontal will be in our necrosis integration will happen with the etiology and pathogenesis or mechanism of celling. What is myocardial systemic pathology? It can happen with the celling. Understand all of you? Now we have something called as spiral integration. You are also going to spiral integration from first to final year. Yes, we have been happening in SPM. They have a lot of spiral integration in SPM because they should know what is the pathology. Entire pathology is implemented in SPM. Have you seen the SPM syllabus? They have different understanding in SPM. Social selection is product panel. और एक्सटीरियर एलिमेंट्स सर कल है ना दिस इज नॉट डेटा practicals okay now again the practicals are just put out now this is the what is this now you see the result on the form 38 of course any is there mostly biology के होता है syllabus
Madam, some ideas about journals.
Now, see empty behavior, see some new term has come here. Empty behavior, all of us are doing that, but we didn't know that this is what an empty behavior. Simple. Whether the student comes for a practical, what do we say? You have done this practical in first year, no reality I'm telling you. Yes or no? Yes. You have done no. Yes. You know the procedure no. Yes. Should I demonstrate for you? No, madam. Stop. Because all the practicals which are there in physiology is here. But what is the emphasis? The emphasis is on how do we interpret the abnormal values with respect to the diseases which are going to study in the count. Is it clear? Okay. So there you know what usually most of the time we are only demonstrating which they have not learned. So let us not this may not 10-15 minutes or first year, you know, I know how teachers struggle with this children. What is that syllabus table? Where is RTC? Where is WBC? Literally, you know, they are focusing there. They are putting a lot of efforts. So by the time they come to second year, they are really skilled in focusing the glucose chamber and doing all that. So what I feel is, we need not go into the details, but if the student says no, madam, we require a demonstration, then we will go ahead. So first ask them. Otherwise, what we can do? You can inform the students that tomorrow we are going to do gradually to study about all the details which are studied in first year, both to the record also of physiology and please come to that. That is what we can tell them.
Madam, some ideas for journals also. Madam, some ideas for journals. Madam, some about journals also. Excuse me, madam. In QCR they asked about direct observation. Are you going to have
They
that?
are not CBDC, they are not supposed to ask us.
They had asked for second year also, whether it is there or
In
not.
my college, they
It
will
asked
ask
for us, madam. So for first year it is there in the syllabus.
what did you show? What did you show?
We had shown the procedure. Yes.
The first year CBDC curriculum, none of them are aware of clarity नहीं है, लॉकडाउन के बारे में clarity नहीं है, BOPS clarity when we did come, when we did online class, you remember January में criteria के बारे में online, that is was wondering what is this BOPS, then we were like assuming things, you know, like blind people touching the elephant, no, we were all doing that. You will a logbook, oh, a practical book can be logbook, observation book can be logbook. Then another person said, no. What notes they take when we do theory class? That is logbook. So all of our posts, we were very happy. We have uploaded all this. What is that? Logbook is entirely different. When you refer to the MBBS logbook, I spoke so I have no clarity regarding the logbook.
Madam, some please give ideas about journals or practical books. Please.
फर्स्ट ईयर में क्या बताया? फर्स्ट ईयर में
वीडियो का ही है, फोटो का नहीं है। हाँ ले ले।
Now, self-directed learning also we can adopt, sir. Self-directed learning means you give the objectives to the student, ask them to do the library reference, or let them do the even you can do the genuine sites on the Google and ask them to do the exercise. So this is called a self-directed learning. So when will you adopt this kind of a learning? Now this is adopted. Now say for example we are taking the class and the attendant will come and the madam principal madam has told all the students should go to the hall. There is a lecture. Some speaker has come and she wants the second year students, so we cannot refuse. So we can tell the students, please carry on. What I want you to do, I will put in the students' group. You will finish the work and come tomorrow. You will enter in the attendance. The topic is over. Otherwise, it is very difficult for us to finish the course. Now, at this point of time, you can resort to this method that is called as the self-directed learning, because we are giving them the direction, but the students is self-learning. Okay, so any difficult, but that is why whatever work we are giving, we have to do the corrections of the work, so that extra work we people have to follow. Otherwise, there is no problem. So this is what, okay? Motivate and direct the students' learning experience. Give them 10. See, we can finish that lecture in 1 hour, but for the students, at least give them 2 to 3 days to complete their learning. Go ahead with the next topic. No problem. Facilitate students' initiatives for the learning. Available for consultation. See, if the student is putting a message in the student's group at 8 o'clock in the night, madam, I have some clarification. I need clarification. You tell, I will clarify. Finish your work and all. Because you will be busy at home, right? After that, you do the clarification. So, we should be available for their learning process. 10 o'clock also they will put the message. They say, oh, why did you put the message at 10 o'clock? Nothing doing. Get up in the morning and put the message. Okay, this is what we have to do. So in self-directed learning, we should be available for the student at any point of time, but not at 2 o'clock in the night. Serve as an advisor. We need to find. When you do this once, and then you will know what is the learning capacity of the students. Children you will not know. Some people will love to do this kind of learning, because some people are bored to sit in the and there are sometimes, madam, my buses are this one, I have to travel for. All these practical difficulties we face in the classroom also. Then we can't tell them, no, go to, especially girls, they have to change 2 buses and go. By the time they reach home, it will be 8 o'clock. So we give them. These are practical difficulties, I think even you have faced in your classes. And we cannot become very strict, no, I will not do what you do. We need to, otherwise there is the pain on. Our students will miss their buses. Okay, you understand this? Yes. Now, this thing that I want to tell you. Now, this is regarding the practicals. Okay. First, we are demonstrating, and then we demonstrate it at a fast pace, and then we demonstrate it with telling them all the points, and then we tell the students you do this procedure, and then finally the student is doing the procedure in the exam. That is the skill they will develop. Okay, so this is demonstration, reconstruction, comprehension, and then performance. So last में क्या होता है exams में summative assessment, the student is performing. Even in formative assessment, the student is performing. Now integration, as I told you, this is over now. I explained to you. Now this is also not there. So I must like this.
मैडम एकेडमिक भी अगर
That's जरूरी नहीं है सर.
मैडम एकेडमिक भी अगर
So finally,
सर बोलते हैं no lesson plan. Take it for granted.
मैडम एक्टिविटीज
It's not necessary for you to do. But we have done this. I have been doing this lesson because Pathology has trained us. For the past 5 years, I have been the lesson plan in my college. You delete everything, you started content. But I am telling you, you need not be anxious about the lesson plan. So, वो भी नहीं बोलेगा. I told you, depend on your college timings. ठीक है? And what is that? You completely the character of NCA. NCA to the universities, and according to their schedule, universities will also give the calendar of events. And when the calendar of events comes to you, then you plan your pathology events. The flow is like this. Now in the university, how the calendar of events will be? 2 months, they will give time. Say for example, October bar September. Sorry, September bar October. They will conduct exams. September bar October. So within these 2 months, theory should be over, validation should be over, practical should be over, and then declaration of the results. Next month, third year CBDC will start. University, in our university, they are very clear about the calendar of events. But they will follow the NCA calendar of events. You see, for the first CBDC, the calendar of events till the internship has been declared by the institution. You take hold of that. Okay? You have to follow that. We cannot go beyond that.
Now you can show the slide of the
I have not done that.
चांदीची स्लाइड
It is different from calendar of events. Okay, no confusion. Academic calendar is nothing but confusion. All this is over. Please follow this in your colleges. No compromise on this. Wherever I went to in the South India training and then Indore training and all other training. Doesn't matter which teacher you don't provide. You agree or not? They said what I am only please. Only Viva is there, only practicals is there. And the students are not writing. In the end, they have to write 5 assessment. What will happen? They will not write in the I said, correct. Do the test. What is the problem? NCR system is don't do. Any instruction is there? Not. Don't conduct written test. Any instruction is there? Do it. All these days, how many tests students are writing on in their classes? In your colleges? In our colleges, in our Karnataka, 3 internal assessment theory they used to write. As per our university, we take the best of the 2, take the average, and that will be the final internal assessment mark, and that will be the eligibility criteria for him to make them appear for the final exam. It will not be included in the final mark, but yes, it will be included in the final marks. So, because it will be included in the final marks, just don't misuse. Be very judicious, deserving students, out of all they deserve, give them. Are you understanding? Not because management will say, why not this teacher? No, don't do that. Because students talk, they feel very, see, if you do this, if we, for example, because it is included in the marks, what we will do, we will yes, there are here, it is there in the book. You have to go to it. You have to implement all of your mistakes. But what I'm trying to tell you is, be judicious when you are giving the marks. Because students are observing us. They will go to teachers who are very, very sincere and give marks based on their performance. They will complain there. And I will get a complaint box. Because in my subject, I don't know that kind of thing. So, face take के marks देने का, मेरा area का बच्चा है, मेरे सामने कितने तो मेरा नानी का काम है, मेरा ससुर का काम है. तो क्या है वो बड़ा affected होता है. And वो क्या बोलते हैं groupism बोलते हैं. And students, whether you teach or not, they are not bothered. But you start doing this kind of activity, they will not forgive you in your life, in their life. Why I am telling you is, many sincere students, and especially boys, tears in his eyes when he came to me. He has passed second year and gone to third year. He says, "Madam, in your subject, what I deserve, I have got. But in other subjects, only passing marks, madam. But in theory, he is of good marks." So, उनका assumptions क्या है? Boys को कम marks दे रहे, girls को ज़्यादा marks दे रहे. He has come to that conclusion, and he is telling me all conclusions now. Madam, for third year I will not study, madam. I will not study, madam. Why should I study, madam? I will only pass. He is such a distinction student. We are demotivating students, such students, and we are responsible for that. And we will, and I see, and another problem is, which teacher has done this, they will not even know. Because this candidate will not go and tell the teacher. Because he is scared. Why that the student is coming to me? Because this is how I create the environment in the college, in the class. And even during the internal assessment, they have observed me. Madam is not partial. Madam is very strict. Madam wants only knowledge. Madam wants only skill. So you need to create that ecosystem in your colleges. And please don't fall into this. Okay? But what I'm trying to tell you is someday go ahead and complain also. Be ready for that. And you will have to tell them why I have given 4 marks for this. See, in our university, we have 4 cameras in the corners. And this is live streaming university. Because of these things. Because they cannot say, call my teacher and say this is what you have done. When they know these complaints are coming out, so they try to find a general solution. So my humble request is, please be sincere to the students. क्या हो रहा है? Because somewhere, that student, he went on to top the PG exams and he came back to our college and so how do you judge me? If you are given such less marks, how really talk to the teacher? Then I told him, no, this is not the way. So you need to motivate her. So, कैसा motivate करोगे? We cannot go and ask them because we have to maintain the relations and all. So we need to tell her, you change this. Don't bother about the results. Put in your efforts. One day, your efforts will bear fruit. See, you see, we are in such a, tight situations. Openly बात नहीं कर सकते, openly बात करें तो फिर से वो बच्चा आगे बढ़ेगा. So many, we need to, we are walking, okay, एक लोग पता ना वो balance लेके चलते हैं वैसा. So please, that is why I say, we teachers are, we teach them, we should be like a friend, we should be like a guide, we should be like a mentor. We have different roles to play as a teacher. It's not just delivering what is there in this implement करना है ना. Who is doing this implementation? A human being, right? All of us are human beings and all of us are unique, right? You are doing it or not? Yes. See, everybody, what to say? We usually look at others. I'm looking at sir, I'm looking at madam. And if I look at me, only go for it. Few percentage I can look at it. We never close our eyes and try to see what is the problem with this. Or how to feel it. Somebody should say, oh, madam, today you are looking very dark. Someone says, madam, today you are shining. Only something is based on them. We are not focusing on us. That is why we need to focus on ourselves. We need to close our eyes and we need to focus on ourselves. And that is what is mad rush in this world. We are only seeing others, seeing others, seeing others. So that is why every morning you have to embrace your own self and say, I love myself. I love the way I am. I love the way I am. I am unique. I am special. I am a masterpiece. All of us are masterpieces. But we have not recognized our position. Why? Because we have allowed others to dominate us in the wrong direction. If you are confident, I'm telling every one of you, bring in that confidence in yourself and you see how confident your students will be. I'm very proud to say in my college, students are proud, they are very confident in my subject. And because they know, you ask them openly, they are able to tell what is the which corner of the R.S.5 syllabus. Because that is how I train them. It takes a lot of efforts, you have to put your efforts, and that is why we are here. We are here as teachers. Please don't talk about the salary component.
I would ask one question. Not regarding this slide. Actually, what we are talking about is a term test. So it means a terminal exam after 6 months. So we have to go for a theory paper or not?
we be successful in implementing the CBDC curriculum, results will not be up to the mark if we don't take the students right. And Dr. Jain said, who told you not to conduct theory? Conduct. What question are you asking? This is what we are asking. Don't allow the students to dominate here. No. Whenever you conduct the Bible, whenever you conduct the practical, tag it with theory possible को conduct it like an exam. Batches बनाओ. Whenever we give practical tips, nobody will give them. Batches बनाओ. 1 week जाता है, जान दे. No problem. It is worth doing it. Last year you want lot of this one. I don't want to talk negative. We want good results, right? You want good results? They should right. Then only they will know where is the mistakes they are making. Otherwise, no. It is not as what you are conditioning them. You are conditioning them. Forward. And preparatory whatever emotions or the mental blocks or whatever is happening in the final exam, they will undergo that in the preparatory exam. This is an experience which I am telling you. Because I have done it in my college. वो कभी-कभी बच्चे blank हो जाता है. It happens. But student will be sitting like this for half an hour. Madam, I don't want to write the exam. मेरा subject है. I am invigilator. 10 years back. What the problem is, they study whole night. Sir said to continue students studying at the time of exam. Whole night. And she has not taken breakfast. कुछ भी नहीं हुआ. इसको क्या होता है breakfast? Which is called as brain fat. Brain fatigue. Then I told her, you sit here, and then I brought her some makeup cover and water and made her put it. She said, no. I said, you sit here. I will not ask you to go. 3 hours for us. I did trigger. If somebody else was there, she started writing after 1 hour. I'm sitting with the Amma. She scored 55 marks. R.S.3 batch. Paper, only 1 paper course. Paper for paper. R.S.3 batch. All experiences are giving you. It happens to students. They go blind. They feel I'm not remembering anything. They need the support. They need the support. No one can do it. If I had told, okay, you can't, then it will go. And R.S.3 को क्या carry over भी नहीं है ना? 6 months क्या करोगे? Back to the see all these things the people have to teach. So preparing it, how when the writing is pre-assessed, you will know what is the problem with the student, whether they are understanding or not. And final preparatory exams, you will know what exactly because they are writing the entire syllabus. Hello, madam. Thank you. What did I tell now? Ask you.
So if they ask for mapping, what should we
Students should be thorough with this. Now you can read here. What is the chapter I think it is cellular information? If I remember, yeah. Now tell them to be thorough with all the SLOs in cellular and information. You have to tell them. You have to write the answers in A4 sheets. Okay? So after you have completed all the chapters in 3A, then you make a bundle. This is a 3A answer. वैसे ही पूरा left तक then you put it by bundles. समझ में आ रहा है? Don't encourage them to write in the books. They cannot maintain the bundle. 5 quarters. Now 5 quarters. So if it is for the exam, there should be condition for formative assessment, condition for writing. So what you can do, whatever specimen you are teaching, ask them to take the photos. All this you should do with the permission of the head of the institution. Everything. You do not be the boss. Or put it in writing. This is what, these are the changes which I want to do. So please give permission. Okay. So whenever, see, one batch will come and
But you have to do the homework before. Auspicious में क्या होता है? Not a single student is sitting here. Okay, continuously. That is why what you can do is you can request your management or principal if it is a PG institution to depute PG students, and they should be like they should not be partial. Friendship होता है ना? PG का बोले लेना चाहिए. They should be sincere and honest. वैसे PGs को आप लेके चलने में बहुत अच्छा है. Yeah. Very nice. So here is the first one is called as the spotter station. Now here in the spotter station they are rotating because they have to identify the 5 spotters. After that, now you tell them you wait for some time and then you that is the best 1 minute arrest later. So you have to plan. In my college I have 2 demonstration rooms and 2 labs. So one is biology lab, one is microbiology lab. So you can do that, no problem. It depends on your availability of the space. Okay, if physiology, you see physiology and pathology are in the same floor, you can request them and ask them to do the lab for 2 days or 4 days. I think they are for 4 days. Then we have the histopathology studies. There also the student is rotating. Okay, after that, and for 1 day, what we have 25 students will be allotted as per the rules. Maximum we can go to 28. Better not to take 28. We cannot do justice. 25 is ideal. See, we'll be very tired because we have to tally and we have to do everything. The next is what laboratory reports. Now all these reports don't keep the normal reports there. You have to tally. You have to tally. Okay. Then now in this it is listen. For the laboratory reports, please don't give the scenario. No, it is not severe or whatever. No. Only the values. You can make it divided into like thyroid profile, lipid profile, renal profile, CBDC, like that. Urine, microbiology also you can take. You can take serology also, thyroid test, and all that. So again, you can sit together. You have to type it. Usually how many are there? Now, because it is OSCE, it should be similar for everyone. Because slides they have kept similar for everyone. So even the result also should be nice, sir. 5 slides. So for example, I think Japanese side is then 5% of test. You can take from salinity, inflammation, accumulation, or cancer. Let it not be too difficult, sir. Please. Let it not practical, sir. Don't be slides let it not be too complicated. The simple method is, say for example, even if we give fatty liver, they will identify as cirrhosis of liver. Why? Because iron here 1%. They will not focus on their and in that they will not see the microscope also. I will be observing. Right? It's cirrhosis of liver. So confidence is okay.
Man, what I did in my college, like I have converted these spots, so not in the, like I don't bring the students to go from one spot to another. I have prepared a PPT presentation of the spot and the question. So I project that spot and the question. I have taken a photograph of all the instrumental slides and reports and instruments. So I project that spot and the question. I give 5 minutes for writing, 3 minutes.
So how many students are there?
At a time, 20 students. But I make them.
You take it to theory classrooms?
Hey, but I make them sit wide apart.
No, but the slide is what you have shown them in the
Yes.
not the network.
No.
But I advise you to do microscope.
Yes.
Then do theory class of that. Theory also we should. Agree or refuse? Agree. And which is microscope is better.
Plus,
Now this is practical microscope. I have given up to 23 marks. We have 25 internal, 25 external, 50 marks for that. RS question. And the student also knows that okay, I have answered this question, I have not answered this question. They have absolutely no complaints at all. Okay, otherwise what is the color pattern? First person, half an hour, all are youngsters, all outside. And when the person goes out, no, what did they ask? What did they ask? And whatever questions they are merely studying that only, but they will not ask. So ऐसा होते क्या होता है? Last person, I was asking you from which place are you? What is your name? From which place are you? Did you write the theory paper well? That person will be happy to ask me any question. Some will be
प्लीज ऑफ करो समझिए प्लीज
ऑफ कर
जल्दी ऑफ करो एंड किया सर
एक बंद करो.
Thank you, Deptt.
थैंक यू